Dr. Miriam Celeste Okafor had been a surgeon for 22 years. She had done her residency at University Hospital in Baltimore and her fellowship in cardiothoracic surgery at the Cleveland Clinic, and she had spent the last 14 years at Harrington Medical Center in Delwood, where she was the chief of thoracic surgery and the person the other surgeons called when a case became something beyond what the standard protocols addressed. She had performed over 3,000 procedures. She had been called into emergency situations at hours that required her to drive fast and think clearly and arrive ready. She had been called in on Christmas Eve. She had been called in on the night of her daughter's spring recital. She had been called in on her own birthday 3 times. She came every time. She came because a patient was already open on the table, or already crashing in the trauma bay, or already beyond the point where the attending on shift could handle it alone. She came because that was what the title meant when it was real and not just a word on a door. She had learned what the title meant from watching the surgeons above her in residency, the ones who came in at 2 in the morning without complaint and stood in the OR until the case was resolved, and then stood in the hallway afterward and answered every question the resident asked. Residency at University Hospital had been 3 years of being tested in ways she had not known were possible. She had been one of 4 residents in the thoracic track. 2 had left before the end of the first year. Not because they could not do the technical work. They could. They left because the technical work was not the full scope of the job. The full scope included the 2 AM calls and the 14-hour cases and the families in the waiting room, and the moment when you had to tell someone something, and the something was not what they were hoping for. Miriam had not left. She had stayed, and she had learned, and she had built the kind of stamina that came from being asked to give more than you thought you had and discovering that you had it. She had operated on her first solo case in year 2, an emergency thoracotomy. She had been in the OR for 4 hours. When she came out, her hands were steady. She had not known her hands would be steady. She had been prepared to manage them if they weren't, but they were. She had noted that. She had thought, this is what I can do. This is the part that is mine. She had carried that into the fellowship in Cleveland and from Cleveland back to Delwood, and it had not changed in 22 years. She had decided early that she would be that kind of surgeon. She had been that kind of surgeon for 22 years. Her residents called her Dr. O. She did not correct them. She had a policy with residents that said, if you have a question at 3 in the morning, call me. I will answer. I would rather you call me at 3 in the morning with a question than not call me and make a decision you were not ready to make. None of them had abused the policy. Most of them had called at 3 in the morning exactly once and then found that they had enough to work from afterward. That was how she had designed it. She had learned from a surgeon named Dr. Elaine Murray, who had been her attending in year 3 of residency and who had told her something that had not left her. Dr. Murray had said the hardest thing in this work is not the technical part. The technical part you can learn. The hardest thing is deciding what kind of surgeon you intend to be before the pressure hits, because the pressure will hit when you are tired and when you are uncertain, and the decision you made in advance is the one that will hold. Miriam had made that decision in year 3 of residency, and it had held for 22 years. She had not missed a call yet. She did not intend to start. She thought about that sometimes in the car on the way in. She thought about what it meant to decide and then to keep the decision. It was the same thing in medicine as in everything else. The decision was not made once. It was made again every time the conditions made it difficult. On a Tuesday evening in October, she received a call at 7:44. The call was from the charge nurse in Harrington's trauma bay, a woman named Patricia Chen, who had been with the emergency department for 16 years and who did not call the chief of thoracic surgery without cause. Patricia said, "Dr. Okafor, we have a 49-year-old male blunt chest trauma from a vehicle rollover pneumothorax with suspected hemothorax pressure dropping attending is asking for you." Miriam was already off the sofa by the time Patricia finished. She said, "I'm coming. Keep the bay clear." She was in the car in 4 minutes. She was at the hospital entrance in 11. Miriam Celeste Okafor had grown up in Delwood. She had gone to Delwood Elementary and Delwood Middle School and Harrington High, the school named for the same family that had built the hospital she now worked in. She had been accepted to 3 medical schools and chosen Hopkins because of the surgery program. She had left Delwood at 18 and come back at 38 because her mother was getting older, and because the hospital had offered her the chief position, and because she had found somewhere in her mid-30s that the city she had grown up in was the place she was supposed to be. She had been back for 14 years. The thoracic surgery program at Harrington had been built by a woman named Dr. Caroline Webb, who had spent 28 years making it into one of the strongest regional programs in the state. Dr. Webb had called Miriam directly, not a recruiter. She had called her and said, "I am looking for someone who will do two things. First, continue what I built. Second, build further than I did. I believe you are that person." Miriam had asked why she believed that. Dr. Webb had said, "Because I have watched your cases through peer review for 3 years. Because I have talked to your residents. Because you grew up here and came back, and people who do that bring something that people who are just passing through don't bring." Miriam had taken the position. She had expanded the residency program in year 3. She had recruited 2 fellowship-trained surgeons who increased the case volume. She had established the thoracic tumor board that now met every other Thursday and drew referrals from 4 counties. She had published 8 papers while maintaining a surgical schedule. She had built further. Dr. Webb had retired 2 years ago. She had come to Miriam's office the day before she left and said, "I want to tell you something." Miriam had waited. Dr. Webb had said, "You built further. That was the thing I was hoping for, and you did it." She had not said anything else. She had left. Miriam had sat at the desk for a while. Then she had gone back to work. She was 53 now. Her mother, Patricia Okafor, was 79 and lived in the same house on Callaway Street where Miriam had grown up. Patricia had moved to Delwood from Lagos in 1965 with Miriam's father, Emmanuel, who had come first and worked for 3 years before sending for her. Emmanuel had died in 2009 from a heart attack. He had been 67 years old. He had lived to see Miriam become chief of thoracic surgery. He had come to the ceremony. He had not said much. He had said your grandmother would have known exactly what to say. "I only know that I am proud." Miriam had told him that was more than enough. She visited her mother on Sunday afternoons. They had tea. Patricia asked about cases in a general way, not in a medical way, the way she had always asked about Miriam's work. She asked, "Who did you help this week?" Not "what did you do," but "who did you help?" Miriam told her. Patricia listened. She sometimes said good and sometimes said that was hard, and sometimes she just nodded and Miriam understood from the nodding what she meant. Her mother had given her something that the residency and the fellowship and the 22 years had not erased. She had given her the habit of understanding what a person was before understanding what was wrong with them. You ask who first a days they used to say, then you figure out what they need. Miriam had carried that into the OR and the trauma bay and every difficult conversation she had ever had with a family in a waiting room. She still drove the same route from her house to the hospital that she had driven as a teenager, past the park on Elm, where she had played as a child, over the bridge on River Road, right on Medical Center Drive. She knew the route in her sleep. She had driven it hundreds of times at night in rain, in the specific quiet of 2 in the morning when the roads were empty, in the specific anxiety of knowing someone was waiting who would not be waiting indefinitely. She had learned to drive this route in the mindset of a surgeon arriving, not a driver commuting. She separated herself from the evening, from whatever she had been doing, from whatever thoughts had been running, and she occupied the drive with the case. She organized what she knew. She identified what she did not know and what she would need to know in the first 30 seconds in the bay. She thought through the likely sequence and the probable complications and the equipment she would call for. She arrived ready. She had always arrived ready. She drove it now. She was thinking about the pneumothorax and the pressure reading Patricia had given her, and the likely rate of deterioration, and whether the hemothorax Patricia suspected was consistent with the mechanism of injury and what that combination would require. She was not thinking about what was waiting at the hospital entrance. She had no reason to think about that. She had been arriving at that entrance for 14 years. The security guard at the main entrance of Harrington Medical Center was a man named Officer Kenneth Webb. He worked the evening shift 5 to midnight. He had been assigned to Harrington for 4 months. He had not been the first choice. The role had been posted for 3 weeks, and the first candidate had taken another position, and the second candidate had withdrawn. Webb had come from a contract security position at a retail center, and before that a brief period as a county deputy that had ended for reasons his personnel file noted. He was 34 years old. He had been told in the briefing what valid hospital credentials looked like. He had been told the verification procedure. He had signed the acknowledgement. He had come to the physician entrance on his evening shifts for 4 months and had seen physicians and nurses and technicians and administrative staff move through it. He had asked to see IDs. He had seen hospital badges and driver's licenses and temporary credentials and all the varieties of documentation that the evening shift at a medical center produced. He had been told what to do when there was a question. He had not done it. He had come from a contract security position at a retail center, and before that, a brief period as a county deputy that had ended for reasons his personnel file noted and that he did not discuss with colleagues. The security briefing he had received when he was assigned to Harrington 4 months ago had covered the entry protocols, the credential verification procedure, and the escalation chain. The briefing had been clear. The credential verification procedure said, when a staff member presents a valid hospital credential, confirm the credential by calling the charge nurse or attending on call and allow entry to the facility during the verification process. Webb had signed the briefing acknowledgement. He knew the procedure. He had not followed it. He would be asked about that in the security review. He would not have a satisfying answer. He saw the car pull into the physician entrance area at 7:58. The physician entrance was designated for medical staff. The designation was marked on the curb in blue paint and on a sign mounted above the door. Dr. Okafor's car was a dark blue 4-door sedan. It was not a car Webb recognized. She parked in the space marked Reserved Physician on Call. She had parked in that space hundreds of times. She knew which crack in the pavement marked the edge of the painted line. She knew the distance from the car door to the entrance was 32 steps at her pace. She knew the access panel beside the door took her badge chip in under 1 second. She had done this enough times that her body moved through the sequence while her mind was already inside the bay. She got out. She was wearing dark slacks and a gray pullover, the clothes she had been wearing at home. She had her hospital ID badge on a lanyard around her neck. She was walking toward the entrance. Webb stepped forward. He said, "Ma'am, this entrance is restricted to medical personnel." Miriam looked at him. She said, "I am medical personnel. I'm Dr. Okafor, thoracic surgery. I have a patient in the trauma bay." She had not stopped walking. She said it the way people said things when they had places to be. Webb said, "I'm going to need you to stop, ma'am." She stopped. She looked at him. She said, "Officer, I have an emergency. A patient is in the trauma bay right now. I need to get inside." Webb said, "I need to see your credentials." She held up the badge on the lanyard. The badge had her photograph. The badge had her name. The badge had her title, Chief of Thoracic Surgery. The badge had the Harrington Medical Center logo and the security chip embedded in the lower right corner. Webb looked at it. He said, "I'm going to need something more than a hospital badge." Miriam looked at him. She said, "What do you need?" He said, "A picture ID." She said, "My picture is on the badge. My name is on the badge. My department is on the badge. What else do you need?" He said, "A government-issued ID." She said, "Officer, there is a patient in the trauma bay right now whose pressure is dropping. I need to be inside in the next 60 seconds. I have my hospital ID. I have been on staff here for 14 years. If you need to call the charge nurse or the attending, please do that right now while I go in." Webb said, "Ma'am, I need you to step back from the entrance." Miriam did not step back. She looked at him. She said, "I am going inside this hospital." Webb said, "You are not going to enter this building until I have verified your—" He reached for the radio on his belt. Miriam said, "You need to call Patricia Chen in the trauma bay right now. Extension 4412. She will confirm who I am in 10 seconds. Webb said, "I make calls on my timeline, not yours." Miriam said, "Someone's timeline is not going to be long enough if you don't make that call." She said it quietly. She was not shouting. She was a surgeon, and she had learned very early that shouting in a crisis consumed attention that belonged to the crisis, and she had applied that lesson consistently for 22 years. She stood in the entrance area and counted seconds the way she counted in surgery. Not frantically, precisely. The way you counted when the count mattered and you needed the number to be accurate. She had been at the entrance for 4 minutes and 20 seconds. She thought about the pneumothorax. She thought about what the pressure reading Patricia had given her meant for the window. She thought about what was happening in Bay 2 while she was standing on a concrete pad outside a door she had walked through hundreds of times. But her voice had an edge that came from a very specific place. The edge came from the fact that there was a man in the trauma bay whose pressure was dropping and whose chest she needed to be looking at. Outside, Miriam stood. She had her phone in her hand. She called the trauma bay directly. Patricia answered in 2 rings. Miriam said, "Patricia, I am at the entrance. Security is holding me. I need you to call administration." Patricia said, "I'm calling right now. How long have you been there?" Miriam said, 5 minutes. Patricia said 5 minutes. She said it the way someone said something when they were adding a number to a calculation. She said, "I'm calling Anita Wallace. Stay there." "I'm sorry, Dr. Okafor." Miriam said, "Don't be sorry. Get Anita here." Patricia said yes. Miriam ended the call. Webb was watching her. She looked at him. She said, "I have just called the Deputy Chief Medical Officer. She will be here in the next few minutes. While we wait, I would like you to look at this badge one more time." She held the badge out. She held it steady and close enough that the text was readable. She said my name, my title, my department, my photograph, the hospital seal, the security chip. This is what a Harrington Medical Center physician credential looks like. You have been looking at it for 5 minutes. Webb said my protocol requires government. Miriam said your protocol is going to be revised after tonight. That is going to happen. But right now, we are still standing here, and there is still a patient in Bay 2, and I am telling you who I am. Webb said nothing. He stood between her and the door. She stood. She counted. Inside the trauma bay, the situation was moving. The attending physician was Dr. Rajan Mehta, 37 years old, 6 years at Harrington. A good emergency physician who understood the limits of what good emergency physicians could manage without backup. He was managing the pneumothorax. He was maintaining the tube placement. He was watching the pressure numbers and the oxygen saturation numbers and the specific way the monitor displayed the information that told him whether the window was closing or holding. The window was holding. It was holding the way a door held against something on the other side, not failed, but not stable. He knew the difference. He had 6 years of learning the difference. He had asked Patricia to call Dr. Okafor at 7:44. He had made that call because he understood what he was looking at and because he understood what Dr. Okafor could do that he could not. He had not hesitated to make the call. There was no version of his training that asked him to wait past the point of decision. He had decided. He had asked. He expected her at 7:55. It was now 8:02. She was not in the bay. Patricia had her phone in her hand. She said she called me from the car. She said she was 11 minutes out. She should be here. Mehta said, "Call the entrance." Patricia called the entrance desk. The entrance desk said there's a situation at the physician entrance. Security is handling it. Patricia said, "What situation?" The entrance desk said, "Security is." Patricia said, "I need you to go to the physician entrance right now and tell me what is happening." She did not ask it as a question. She was 16 years in the trauma bay. She had managed situations that required 30 things to happen simultaneously. She had managed situations where the attending was down with a needle stick and the resident was on the phone and the monitor was showing 3 things at once, and she was the one holding everything together. She could hold the bay and make the calls. She made the calls. She called the entrance desk. She called security control. She called Anita Wallace's office. She stood in Bay 2 with the monitor showing what it showed, and she did not stop doing her job while she made the calls. She watched Gary Hollis's pressure. She watched the numbers. She talked to Mehta between calls. She was the thread that held the situation together on the inside while Miriam was standing on the outside. That was the thing about Patricia Chen. She did not stop. She had never stopped in 16 years. Mehta looked at the monitor. He said, "What's the status?" Patricia said, "She's at the entrance. Security is holding her. I'm calling administration now." Mehta said, "Call administration now." Patricia was already dialing. The patient's name was Gary Hollis. He was 49 years old. He coached his daughter's soccer team on Saturday mornings. He had been doing it since she was 8 years old, and she was now 14. And he had told her last Saturday that he would keep coaching until she told him to stop. She had not told him to stop. He had 2 daughters, Keisha, who was 17 and applying to colleges in the fall, and Deja, the soccer player, 14. His wife, Cherie, had been waiting at home for him when the hospital called. He had been driving back from a job site in his truck. He ran a small construction and renovation crew, 3-men jobs that ranged from single rooms to full-gut renovations when a delivery truck in the oncoming lane crossed the center line on Route 9. The truck driver had fallen asleep. The investigators found that later. The impact caught Gary's driver's side door and spun his truck into the guardrail. The guardrail stopped him. Gary had been conscious at the scene. He had been talking to the paramedics. He told them his name. He told them his wife's number. He told them he was okay. He was not okay. The paramedic noted the signs in the ambulance. By the time Gary arrived at Harrington, the blood pressure had dropped and he had stopped talking, and the paramedics had moved from calm to urgent in the specific transition that meant the window was closing. He was in Bay 2. Dr. Mehta was doing everything he could do. He was doing it well. But Dr. Mehta knew what he could do, and he knew what this case needed, and what this case needed was Miriam Okafor. Miriam Okafor was at the entrance. She was standing outside. She was standing outside because a man who had been assigned to a door 4 months ago had decided in a few seconds that she did not look like who she was. The seconds were passing. The pressure in Bay 2 was not waiting for the seconds to stop. The entrance desk clerk was a young woman named Destiny, who was 22 years old and had been working at Harrington for 8 months. She walked out the side door to the physician entrance area, and she saw Dr. Okafor, and she saw Officer Webb, and she understood what she was looking at within 3 seconds. She said, "Dr. Okafor." Miriam looked at her. She said, "Destiny, I need to be inside." Destiny looked at Webb. She said, "This is Dr. Okafor. She is the chief of thoracic surgery. She has been on staff here for 14 years. I have processed her ID badge at least 12 times since I started." Webb said, "I have not been able to verify." Destiny said, "I am verifying her right now. I am telling you who she is." Webb said, "Verification requires official documentation from..." Destiny said, "I'm going to call the hospital administrator on call." She did not wait for him to respond. She pulled out her phone and called. While she was calling, Webb said to Miriam, "Ma'am, you need to step back from the entrance." Miriam said, "I have been standing here for 6 minutes. There is a patient in Bay 2 whose pressure is dropping. Whatever you need from me, I have already given you. You have my badge. You have been told who I am by a staff member. I am asking you one more time to let me do my job." She said it clearly. She did not shake. She had learned in medical school to use what she was feeling rather than react to it. The feeling was information. She used it. She stood in front of the entrance she had used hundreds of times, and she used the information. She was a 53-year-old surgeon who had completed more than 3,000 procedures. She was the person Gary Hollis needed on the other side of the door. She was standing outside the door. Webb said, "Until I receive confirmation from my supervisor." He reached out and put his hand on Miriam's arm. She looked at his hand on her arm. She looked at him. She said, "Remove your hand." She said it the way she said things in the OR when something needed to change immediately, and the person needed to understand that immediately. He removed his hand. He stepped slightly to the side. He said, "I need you to wait here." She stood in front of the entrance and she made herself breathe the way she breathed before a difficult case. She thought about the case. She thought about Gary Hollis. She thought about what Patricia had told her on the phone and what the numbers had said and what the combination meant. She thought about what would happen if the window closed before she got inside. She thought about the specific weight of that. She thought about Gary's daughters, who existed in her mind only as the number 2. 2 daughters. Cherie's daughters. The daughters who were somewhere this Tuesday evening doing whatever they did on Tuesday evenings. She had not met them yet. She thought, "I'm going to make sure I meet them." She said to Webb, "I am asking you one last time to let me do my job. Not for me. For the man in Bay 2. Whatever you need to verify about me, verify it. But I need you to understand that someone's life is on the line on the other side of that door." Webb said, "I cannot let you enter until..." Miriam said then, "Call whoever you need to call, right now, quickly." He was reaching for his radio when Destiny came through the side door. She waited. She counted. She had been counting since she got out of the car. She had been in this work for 22 years, and she had stood in many hard situations, and she had learned in all of them that you did not lose track of what you were counting. You counted. You kept counting. You stayed ready to move the moment the door opened. Inside Bay 2, the attending said, "Where is she?" The monitor showed what it showed. Patricia had her phone out. She said, "She's at the entrance. Security won't let her through. Mehta said I need her in this bay in the next 3 minutes. Patricia picked up the bay phone and called security control directly. She said, "This is Patricia Chen, charge nurse trauma bay. Dr. Okafor is being held at the physician entrance. I need her cleared immediately. This is a medical emergency, and I am telling you that the patient's outcome depends on her being in this room." The voice on the line said the officer on site is. Patricia said, "I am not calling about the officer. I am calling to tell you that someone's life is in immediate danger, and your officer is standing between that person and the surgeon who can save it. You need to clear her right now." There was a pause, then clearing. The clearing came through at 8:05. Miriam had been outside for 7 minutes and 40 seconds. 7 minutes and 40 seconds between the parking space and the entrance. At a moment when the window for the patient in Bay 2 was a question that had not yet been answered. She would carry that number. She would carry it the way you carried the numbers that changed what you understood about what was possible and what it cost. Dr. Anita Wallace was the hospital administrator on call. She was also the deputy chief medical officer of Harrington Medical Center. She had been in her office finishing a report when Destiny's call came through. She had worked at Harrington for 19 years. She had been deputy chief medical officer for 7. She knew Miriam Okafor the way people knew colleagues they had worked beside for 14 years. She knew her the way you knew someone whose cases you had seen, whose residents you had watched develop, whose judgment you had come to rely on in situations that required it. She walked down to the physician entrance at a pace that covered the distance in 90 seconds. She came through the side door. She saw Miriam. She saw Webb. She saw the expression on Miriam's face, which was the expression of a person who had been doing exactly what was asked of them for 7 minutes and 40 seconds. She said Miriam. Miriam said Anita, Bay 2. Anita turned to Webb. She said, step aside. Webb said, ma'am, I was in the process of... Anita said, I am Dr. Anita Wallace, Deputy Chief Medical Officer of this hospital. The woman you have been detaining is Dr. Miriam Okafor, Chief of Thoracic Surgery, 14-year staff member. Step aside now. She said it the way a person said something when the sentence was the last sentence. Webb stepped aside. Miriam walked through the entrance. She did not look back. She had been looking at the entrance for 7 minutes and 40 seconds. She was done looking at the entrance. She did not run. She walked at the pace she always walked when she was going into a bay which was faster than most people's running. She had her gloves on before the door closed behind her. She was in Bay 2 11 seconds after the entrance cleared. She pulled on gloves without breaking stride. She was at Mehta's side in 3 seconds. She said, tell me the numbers. He told her. She looked at the monitor. She looked at Gary Hollis. She assessed in the first 30 seconds the way she assessed in every bay moving through the sequence that 22 years had made automatic. She looked at the chest. She looked at the rhythm. She looked at the pressure curve on the monitor. She looked at the saturation number. She looked at Gary's face. She said, Gary, my name is Dr. Okafor. I am the thoracic surgeon. I need you to hear my voice. You are going to be all right. Stay with me. Gary's eyes opened slightly. He did not speak, but his eyes tracked to her voice. He was there. He was still there. She turned to the team. She made eye contact with Mehta first. He gave her the rapid report in the language they both spoke. She received it and integrated it in the 8 seconds he took to give it. She said what she needed to the scrub tech. She said what she needed to the anesthesiologist. She said, we are going to move quickly. I need everyone ready. They were ready. They had been ready. They had been ready before she entered the room. That was the thing about the team in Bay 2. They had been ready since Patricia called Dr. Okafor at 7:44. They had been in this bay managing this patient while the entrance situation resolved, doing their jobs with the precision and the calmness that the job required. Mehta had done what he could do. Now Miriam could do what the case needed. She did it. Gary Hollis was still there, because the 14 minutes between Patricia's first call and Miriam's entry into the bay had been held together by the team in Bay 2. And because when Anita Wallace said step aside, Officer Webb stepped aside. Miriam worked for 2 hours and 19 minutes. She did not leave the bay. She did not look at anything except what was in front of her. This was the part she had been trained for. This was the part that had required 22 years to build, and that required her to bring all 22 years to every case. She did not think about the entrance while she worked. She thought about what was in front of her and what it required. She thought about the chest cavity and the pressure and the specific demands of the procedure. She communicated with the team in the clear and minimal way she had developed over years of surgeries. She gave instructions precisely. She received information precisely. She adapted when the case required adapting, which it did twice. She held the thread of the case from the moment she entered the bay to the moment she stepped back. This was the part of the work she had done for 22 years. The part that required everything and received everything, and left her standing at the end of it with the specific combination of exhaustion and certainty that told her the case was resolved. Gary Hollis was moved to the ICU at 10:23. He was alive. His pressure had normalized at 9:47. His lung was re-expanding on schedule. His daughters would be there in the morning. Cherie had been in the family waiting area since 8:15. Mehta had gone out to talk to her at 8:30. He had told her your husband's surgeon is working on him. He is in good hands. We will update you as soon as we have information. Cherie had said, is he going to be okay? Mehta had said Dr. Okafor is one of the best thoracic surgeons in the region. He is in the best possible place right now. That was the truthful answer. It was the only kind he gave. Cherie had sat in the waiting area and held her phone and waited. At 10:45, Miriam walked out to the waiting area. She sat down across from Cherie. She said, I am Dr. Okafor. Your husband came through surgery. He is in the ICU and his numbers are where we want them. He is going to have a recovery that takes time, but he is going to recover. Cherie looked at her for a moment. Then she covered her face with her hands. Miriam sat with her. She did not rush. She waited until Cherie was ready to ask questions. Then she answered every question. Miriam came out of the bay at 10:40. She stood in the hallway. She pulled off her gloves. She stood there for a moment with the gloves in her hand. Patricia brought her a cup of water. Miriam drank it. She said, how is he? Patricia said, stable. Pressure normalized at 9:47. ICU is ready for him. He's going to be okay, Dr. Okafor. Miriam said, good. She said it the way she always said it when the outcome was the one that was supposed to happen. She said it, and then she stood in the hallway and let the case settle. She always did this after a long bay call. She stood still and let the urgency decompress, and let the case become something that had happened and was finished. She thought about the 7 minutes at the entrance. She thought about Webb's hand on her arm. She thought about what 7 minutes meant to a patient whose blood pressure was doing what Gary Hollis's blood pressure had been doing. She had been in surgery long enough to know that 7 minutes at the wrong moment was not a number you discussed abstractly. It was a number with outcomes attached. She thought about all the things that had not gone wrong. She thought about Patricia making the calls. She thought about Destiny walking out the side door. She thought about Anita arriving at 90 seconds. She thought it worked out this time. It worked out because the people around the situation did their jobs. She thought, but it was 7 minutes, and I am going to say so. She went to the surgeon's lounge. She sat down at the desk. She opened the incident report form on the hospital system. She wrote it the way she wrote everything completely accurately in the order in which things had occurred with the specific times and the specific words and the specific actions. She did not soften it. She did not conclude. She described. She described arriving at 7:58, the badge presentation at 7:59, each exchanged the physical contact at 8:03, the call to Patricia, the call by Patricia to administration, Destiny's verification, Anita's arrival, the clearing at 8:05 entering the bay, at 8:06, Gary Hollis's status at entry. She wrote in my professional judgment the 7 minutes and 40 seconds in which I was detained outside the entrance while a patient in active distress was in the trauma bay constitutes a situation that requires institutional review and corrective action. I am available to discuss this report with anyone who requires clarification. She submitted it at 11:22. She drove home. She drove the same route she had always driven past the park on Elm, where her father had taught her to ride a bicycle on a Saturday morning in 1979 over the bridge on River Road, and she thought about the 7 minutes and 40 seconds and what they had cost and what they had produced. They had cost 7 minutes and 40 seconds in which Gary Hollis had been in Bay 2 without the surgeon his case required. They had produced a report, a review, a termination, a protocol, an article in 14 states, a conference speech, and a card given to a surgeon from 2 counties north who was going to file her report. The 7 minutes and 40 seconds had produced more than they had cost. She thought about that. She sat at the kitchen table for a while. She thought about her mother asking, "Who did you help this week?" She thought, "I helped Gary Hollis. He is going to see his daughters." She thought, "And I am going to make sure this does not happen to whoever comes after me." She went to sleep. She was up at 5:15. She had rounds at 7. On Sunday, she went to her mother's house on Callaway Street. Adiz had tea ready. She had read the article. She read everything with her daughter's name in it. They sat at the table. Adiz said, "Who did you help this week?" Miriam said, "A man named Gary. 2 daughters, he coaches soccer." Adiz said, "Good." She poured more tea. She said, "And the other thing?" "The 7 minutes." Miriam said, "Yes." Adiz was quiet. She said, "Your father would have been very angry." Miriam said, "I know." Adiz said, "I am also angry." Miriam said, "I know, Mama." Adiz said, "But you went inside." Miriam said, "I went inside." Adiz said, "And Gary is going to see his daughters." Miriam said, "Yes." Adiz said, and now there's a protocol. Miriam said, now there's a protocol. Adiz nodded. She said your grandmother would have known exactly the right thing to say. Miriam said, what do you think she would have said? Adiz thought. She said she would have said they showed you what they had. You showed them what you have. Now go back to work and eat something. Miriam smiled. It was the first full smile in 4 days. Adiz saw it. She said, there you are. Miriam said, here I am. The incident report went to the hospital administrator, the chief of security, and the hospital's equity officer within 24 hours. Anita Wallace called Miriam the next morning. She said, I have read the report. I want you to know that this is being taken seriously at every level. Miriam said, good. Anita said, I also want to tell you that I am sorry. Miriam said, the apology I want is the one that comes with a policy change. Anita said it will. Anita Wallace convened the review meeting 2 days after the incident. The room had 7 people in it. Miriam was there. The chief of security was there. Hospital legal counsel was there. The patient relations officer was there. The equity and inclusion officer, a man named Dr. James Osei, no relation to Reginald, was there. And Anita, who ran the meeting. The meeting lasted 2 hours. Miriam presented her incident report. She read it aloud because she wanted every word heard in the room not skimmed on a page. She read the times. She read the exchanges. She read what Webb had said and what she had said and what Destiny had said and what had happened at 8:03. When she finished, the room was quiet for a moment. Then Anita said, does anyone need clarification on anything in that report? Nobody needed clarification. The Department of Security reviewed Officer Webb's conduct over 4 days. The review found that Webb had failed to accept a valid hospital ID credential from a staff member, had failed to use the verification protocol that required contacting the charge nurse or attending on call when a credentialed staff member presented at an emergency entrance, and had made physical contact with a staff member without cause. The review also found that this was not the first incident in Webb's 4 months at Harrington. There had been 2 prior situations in which he had delayed staff entry at the entrance. Both had been logged but not formally reviewed. The review board reviewed them. Webb was terminated. The hospital revised its physician entrance protocol. The new protocol required any security officer who encountered a credentialed staff member to contact the charge nurse directly within 60 seconds of any dispute without exception, and without delaying the staff member's entry if any registered staff member could verbally confirm identity. The protocol was written by the hospital's legal counsel in collaboration with the medical staff committee. It was named the Emergency Access Protocol. Miriam had not asked for it to carry any other name. She thought standards should be named for what they did not, for what had caused them. She had made that argument to the committee, and the committee had agreed. The protocol went into effect 2 weeks after the incident. Anita sent Miriam a copy the morning it was adopted. Miriam read every paragraph. She read it standing at her desk, not sitting with the focus she gave to documents she needed to understand completely before she could use them. She had one suggested revision. She thought about it for 20 minutes before she wrote it. She thought about Webb's hand on her arm. She thought about the counting. She thought about the 7 minutes and 40 seconds and what they had meant for Gary Hollis, and what they might have meant if the situation had resolved differently. She thought about what a protocol needed to say so that the next person, the next physician arriving at that entrance at 2 in the morning or 7:58 on a Tuesday had protection that she had not had when she parked in the space marked Reserved Physician on Call. She wrote the revision and sent it to Anita. The revision said in no case shall a credentialed staff member be physically impeded from entry during an active medical emergency, regardless of the status of identity verification. Physical access to the facility shall not be used as leverage in a verification dispute. Anita incorporated it without change. The protocol was distributed to all security personnel. All security personnel were required to sign acknowledgement within 5 days. All security personnel received 2 hours of training on its application within 30 days. Webb had been terminated before the protocol was adopted. But the protocol was not about Webb. It was about every person who would stand at that entrance after him and every physician who would arrive at that entrance in the next 20 years at 2 in the morning or 7:58 on a Tuesday evening. Miriam thought about that when she read the final version. She thought this is the thing that lasts. Not the incident. Not the article. Not the apology from the hospital board. The protocol. The protocol was the thing that lasted, because it was the thing that changed behavior going forward, rather than documenting behavior that had already occurred. She had learned that distinction in medicine. A diagnosis told you what had happened to a patient. A protocol told you what would happen to the next one. The protocol was for the next one. She had written it for the next physician who would park in that space at 7:58 and walk toward that entrance and reach for the badge that had always been enough before. Dr. Reginald Osei was a cardiologist at Harrington. He had been on staff for 9 years. He was on the medical staff committee. He had been in the meeting when the new protocol was discussed, and he had voted for it without hesitation. He had also added something to the committee discussion. He had said, "I want the record to show that what happened to Dr. Okafor on Tuesday is not an isolated experience for physicians who look like her. It is the kind of thing that happens at the intersection of a credentialed physician and a security assumption." The protocol addresses the procedural failure. The committee also needs to acknowledge the assumption. The committee chair had said noted for the record. Reginald had made sure the note was in the record before he left the meeting. After the meeting, he found Miriam in the hallway near the surgeon's lounge. He said, "How are you?" She said, "I'm fine." He said, "Actually, how are you?" She stopped walking. She thought about it. She said, "I am angry. I am tired in a way that is not about sleep. I'm glad Gary Hollis is going to see his daughters on Thursday. All of those are true at the same time." Reginald said, "That sounds right." She said it was 7 minutes. He said, "I know." She said 7 minutes is not a long time in most situations. He said, "No." She said, "It is a very long time in a Bay 2 situation." He said, "Yes." She said, "He made it. That is the thing I have to return to. He made it, and the protocol is changing, and the person who did it is gone. Those are the outcomes." Reginald said, "They are. And so does the 7 minutes." She said, "Yes, so does the 7 minutes." He said, "I put it in the record." She looked at him. He said in the committee meeting, "I said it explicitly. I put it in the record that what happened to you is not purely a procedural failure. I wanted that said, and I wanted it documented." She said, "Thank you." He said, "You don't have to thank me for that." She said, "I know, but thank you." She said it the way you said something when you intended to carry it with you. Mehta found her in the hallway after she came out of the family waiting area. He said, "Dr. Okafor." She said, "Rajan, good work in the bay tonight." He said, "I want to say something." She waited. He said, "I was in that bay watching the clock. I know what 7 minutes means in that situation. I want you to know that I understand what that cost." She said, "It could have cost more." "It didn't. That's because you and Patricia held the bay." He said, "I know. And I know that doesn't make the 7 minutes acceptable." She said, "No, it doesn't." He said, "What are you going to do?" She said, "I wrote the report. The review will happen. The protocol will change. I am going to make sure of that." He said, "Is there anything I can do?" She said, "Write your own account of what you were experiencing in that bay during those 7 minutes. The times, the monitor readings, what the situation required. I want the record to include what was happening on the inside while I was being held on the outside." He said, "I will write it tonight." She said, "Thank you." She walked down the hall. She thought he will write it tonight because that is the kind of physician he is. She thought that is the kind of department I am building. The story ran in the Delwood Tribune 4 days after the incident. The reporter was a young woman named Sandra Chu who covered health and public safety. She had received a tip from someone inside the hospital. She called Miriam's office. Miriam took the call. She told Sandra what had happened. She told it exactly. She did not minimize the 7 minutes. She did not editorialize. She described what Patricia had said on the phone, what she had said to Webb, what Webb had said to her, what Anita had said when she arrived, and what happened in Bay 2 after the entrance cleared. She said the outcome for the patient was good. I want people to know that. And I want people to know that it was 7 minutes. Both of those things are true. The article ran on Thursday. The headline said, "Harrington's chief of thoracic surgery was held at the entrance for 7 minutes, while a patient in the trauma bay waited. She went inside and saved his life." The article was 3,200 words. Sandra Chu was 28 years old and had been covering health and public safety for 2 years. She had done the work completely. She had the incident report. She had Mehta's written account of what Bay 2 looked like during the 7 minutes. She had the prior incidents in Webb's 4-month file. She had the specific details of the new protocol. She had Gary Hollis's statement, which he had given voluntarily from the ICU. Gary's statement said, "I am alive because Dr. Okafor is very good at her job. I want people to know that. And I want people to know what she had to go through to get into that building." 7 minutes doesn't sound like a long time until you understand what 7 minutes means when someone's chest is doing what mine was doing. Sandra used the statement as the second paragraph of the article. The article was shared by 640 people in the first 24 hours. It was picked up by the State Medical Association's newsletter on Friday. The State Medical Association issued a statement supporting the revised protocol and calling on hospitals across the state to review their entrance security procedures. The hospital board sent Miriam a formal communication acknowledging the incident and affirming the steps taken. Miriam read the communication. She put it in the folder where she kept documents she needed to track. She did not respond to it. She had already said what she needed to say. The Dellwood Hospital Board released a statement. The statement said the hospital's commitment to safe and dignified access for all medical staff was absolute, and that the measures taken following the incident reflected that commitment. Gary Hollis's wife called the hospital on Friday. She asked to speak to Dr. Okafor. They connected the call. Gary's wife said, "I heard what happened. I don't know what to say." Miriam said, "Your husband is doing well. That's what matters." Gary's wife said, "It matters that you were there." Miriam said, "I was doing my job. That's what I'm here for." Gary's wife said, "We know. We are grateful." Miriam said, "Tell him I will check in on Saturday." She checked in on Saturday. Gary Hollis was sitting up. His color was back. His daughters were there. Keisha at the chair by the window, and Deja beside the bed, both doing the thing teenage daughters did in hospital rooms, which was trying to appear calmer than they were. Cherie stood when Miriam came in. She said he tried to give Deja instructions about soccer practice this morning. Deja said from the hospital bed. Gary said the left flank positioning was relevant information. Keisha said, "Dad." Gary said it was timely information. He looked at Miriam when she came in. He said, "Dr. Okafor." She said, "Gary, how are you feeling?" He said, "Like someone did surgery on my chest." She said, "I did. How do you feel about that?" He said, "Grateful doesn't cover it, but it's all I have." She said, "It doesn't have to cover it. It just has to be true." He said, "It's true." She checked his chart. She looked at the numbers. She said, "Your pressure is excellent. Lung is re-expanding exactly as it should. The tissue looks good. You are going to have a very boring recovery." He said, "Boring sounds good to me right now." She said, "It should. Boring is the goal." She looked at Keisha and Deja. She said, "He needs rest. An hour at a time, then breaks. No drama." Keisha said, "We'll keep it calm." Deja said, "We're very calm." She said it in the way a teenager said something when they knew it was slightly untrue and were hoping no one pushed on it. Miriam looked at her. She said, "I can tell." She almost smiled. She checked his chart. She looked at the numbers. She said, "You're tracking well. Keep resting. Your body did the hard part." She started toward the door. He said, "Dr. Okafor." She turned. He said, "I heard what they did at the entrance." She said, "Yes." He said, "I'm sorry that happened to you." She looked at him. She said, "You have nothing to be sorry for. Rest." She left. She walked down the hall. She walked to her office. She had rounds at 7 the next morning, and 3 cases scheduled, and a committee meeting at noon. She sat at her desk. She thought about the 7 minutes. She thought about Gary's daughters sitting on either side of the bed. She thought about what 22 years of this work had taught her, which was that the outcome you fought for was not always the outcome you got, and that when it was the outcome you got, you did not waste it. She had not wasted it. 6 weeks after the incident, the State Medical Association invited Miriam to speak at their annual conference on patient safety. The topic they proposed was institutional access protocols for on-call physicians. She accepted. She prepared for 3 weeks. She did not prepare by drafting a narrative of her own experience. She prepared the way she prepared for a procedure. She reviewed the relevant literature on institutional access protocol design. She reviewed incident data from 4 hospitals that had revised their entry procedures in the previous 5 years. She identified what the effective protocols had in common. She spoke for 22 minutes. She talked about protocol design. She talked about specific language that protected on-call physicians without compromising security function. She talked about the importance of filing reports consistently and early because documentation aggregated over time into records that institutions could not ignore. She talked about what happened after the Tribune article ran. She did not make this speech about herself. She made it about what could be built. Afterward, a woman approached her, an orthopedic surgeon, 2 counties north. She said something similar happened to me. 2 years ago, I never filed a report. Miriam said, why not? She said I thought it wouldn't go anywhere. Miriam said it might not have then. But reports aggregate. The third one changes what the second couldn't. File it retroactively if you can. And if there is a next time, file it the same day. The woman said I will. She said it the way people said things when they were committing, not just agreeing. Miriam gave her card. She said, if you need help with the language, call me. The woman took the card. She said thank you. Miriam said the protocol is on the Harrington site. It's public. You can use it as a template. Miriam drove home that evening. She drove past the park on Elm and over the bridge on River Road. She thought about the woman from 2 counties north. She thought about all the physicians who had been stopped at entrances and had not filed the report. She thought the report is what changes the record. The record is what changes the protocol. The protocol is what protects the next person. She went through the next morning's case files. There were 3 cases scheduled. One was a resection she had been planning for 2 weeks with the patient, a 61-year-old former teacher named Margaret, who had gone through diagnosis with a specific combination of fear and practicality that Miriam had come to recognize as the response of people who faced difficult things by understanding them completely. Miriam had spent 40 minutes with Margaret the previous week explaining every step. Margaret had asked questions that told Miriam she had done her own reading. Miriam liked patients who did their own reading. She liked that they came to the conversation prepared to understand, rather than simply to be told. She had told Margaret the procedure is complex, but the plan is clear. I have done this procedure many times. You are going to be all right. Margaret had said, I trust you. Miriam had said, good. Rest well this week. Margaret was scheduled for Tuesday at 7. Miriam reviewed the preoperative notes. She reviewed the imaging. She thought through the sequence. She was ready. She was always ready. The work was there. The work was always there. She had 3 cases and a tumor board and a resident who had called her at 2 in the morning with a question 3 weeks ago and had not called since, which meant the resident had what she needed now to work from. She had helped build that too. She had helped build all of it. The department. The protocol. The residents who became surgeons who called other residents at 2 in the morning and answered. The record that made the next thing possible. She gave it what it required. That was the whole of it. Subscribe our channel. We tell the stories of the people who came through the door anyway.